Hi everyone, this is Pinkasha from Pazcare. Thank you everybody for joining and welcome Ekta and Dr. Mahadev. Very happy to see you on the call and thank you for taking out the time to host a very important webinar today on the importance of cancer screenings. So, hi, Dr. Abhishek. I also wanted you to cover that when we do cancer screenings and how are doing screenings and doing regular checkups help you detect issues. All right. Hi, everyone. We are Pazcare. So today's topic for the session is the power of early cancer detection and screening. We have with us Dr. Mahadev Abhishek. He's an esteemed oncologist. In this webinar today, I wanted to also focus on that World Cancer Day is observed on Feb 4th across the world. And on the similar lines, just to uh, help everybody to know more about cancer. Cancer is affecting millions, and just increase the awareness and proactive measures and how we can make a difference by detecting this issue early. We thought let us also host a webinar on cancer awareness. And we have with us our partners, Aura Health, who has helped us. Get the right expert to host this session. Thank you so much, Dr. Mahadev, for joining. We want to start with a brief introduction about you, uh, your journey as an oncologist, surgical oncologist, and yeah, then we can begin with the webinar.
Yeah. Hi everyone. I'm Dr. Abhishek. Yeah, I did my MBBS from Bangalore Medical College. After that, I did my surgical training in JNMC, Belgaum. Following that, I worked for 2 years as a general surgeon, and then moved on to become an oncosurgeon. I did my super specialization in oncosurgery from Kidwai Memorial Institute of Oncology, Bangalore, and I completed it about 2 years, 3 years back. I've been seeing only cancer patients from the past 5 years. Okay.
Sure. Thank you so much, Doctor, for this introduction. So, yes, so let's start with the webinar. We have good audience. So, audience, if today you also have an option to raise your hands, to put your questions on the chat, and you'll be able to speak with the doctor today one to one. So, let's begin with the webinar. Over to you, Dr. Abhishek.
Yeah. Yeah. I'd like to. I'll be talking about cancer prevention and like to give some tips for a healthier lifestyle. Uh, as you're aware, everyone is at a risk for cancer. One in five persons will have a cancer in their lifetime. So the incidence is about 20% of the population will can develop cancer. What is cancer? There is uncontrolled cell growth. That is, without even any stimulus, the cells continue to grow. In a normal tissues, when the cells have certain signals, when required, they multiply and they also get signals to stop. But in cancer, the cells don't follow any of these rules and they continue to multiply. This character they acquire through some mutations in their genes, and they acquire some special characters to avoid um, being under the control of the body and other our immune system. Sometimes the immune system also takes care of abnormal cells. The cancer cells acquire the capacity to evade these immune mechanisms as well. So they continue to grow without any control. That is when we call it as a cancer. And there are multiple causes for cancer. Could be genetic factors, environmental exposures, and lifestyle choices. All this can contribute to cancer development. Uh, this is the same thing as I told. The cancer is not, and the cancer it's not a single disease. That we call it as cancer, but the each organ is different. The cancer in each organ, each body system is different. The breast cancer is different from colon cancer. Every cancer they behave differently, they spread differently. So even in each cancer, considering breast cancer, there are different subtypes within the breast cancer, and each of these subtypes also behave differently, and the treatment also varies. So when you say the cancer word, the notion is that all cancer is the same and all cancer is the treatment is not there, and the people carry the same myths forward. Every cancer is different. There are some cancers which can be completely cured as well. These cancers, they invade the tissues. That is, initially they invade the tissues which are nearby, and then from there they can invade into the smaller blood vessels, and from there they can be carried to any part of the body. That is called as metastasis. As I said, there is a role for immune system of the body to in the initial stages when there are abnormal cells which can get detected by the immune system. Most of the cells get destroyed by our immune system. But few cancers acquire the capacity to evade that, and those proliferate and show up as cancer. There can be the cancer itself. When you call tumor, the tumor is different from cancer. Cancer is always malignant. That is, they can spread to other organs. But the tumor can also be benign. Sometimes all masses are not cancer. They can be benign or they can be malignant. Benign is they can be completely cured and they won't spread to other organs. And as I said, the cancer is a leading cause of death globally. As per recent statistics, about 1/6 of the worldwide deaths is attributed to cancer. Uh, as you are aware, there are certain factors which can be changed, which can help prevent cancer. Not all factors which cause cancer can be controlled. That's why we consider the cancer risk factors into two categories: non-modifiable and modifiable risk factors. The non-modifiable risk factors are the age, the genetics, the family history, the gender. These factors, they cannot be changed. But there are few modifiable risk factors, which are the ones which can be changed by lifestyle modifications. These are the tobacco, alcohol, sedentary lifestyle, obesity, unhealthy diets, unsafe sex practices, workplace exposure to certain harmful chemicals, and exposure to sunlight, and certain chronic infections. These are the modifiable risk factors are the one which we have to, which can be modified, which is in our hands and we can control it, and this can help reduce the incidence of cancer. The role of diet and nutrition. There are certain foods which have been associated with certain cancers, especially the red meat and processed meats. They have been known to cause increased risk of colon cancer. That's why what we observe is the vegetarians are at very low risk of colon cancer, and people who consume red meat are at a higher risk. And especially in the Western countries, the colon cancer is at a very higher incidence than seen in India because of their um, more consumption of red meat, and also the processed meat. That is the meat which is stored. For storing, they use certain chemicals, nitrates and nitrites. These are known to cause colon and gastric cancers. The the more vegetables and more grains and the more legumes you consume, you get more vitamins and minerals which help in fighting the cancer. It is advised to take at least 5 servings of fruits and vegetables. It can be the 3 servings of fruits and 2 servings of vegetables, or 2 servings of fruits and 3 servings of vegetable per day. This helps to bring down the risk of cancer. And also try to avoid sugary beverages and processed beverages with preservatives. These are known to increase the risk of cancer.
Sorry to
Yes.
stop you. I can see some editing happening on the screen. I just wanted to like keep you informed. Is it you or like
No,
if
I was also, I thought it was something which they are doing.
okay, I'm not sure what's happening because we don't have access. I mean, nobody has access to do it. If you can quickly check, because we are not able to read a lot of words on the screen properly.
Okay.
Yeah.
I think maybe the annotations somebody has clicked by mistake. If you can
Yes,
see
Hello.
that.
because I also
Hello.
just checked.
I think the
Annotations.
problem is I
Annotation
think.
is enabled. Yeah.
Annotation somebody has clicked by mistake, so you have to just remove that.
Okay. Can
I think Dr. Abhishek should have that annotations and remove that, and that's just gone haywire. Unless somebody is giving it to their child.
Maybe you can stop the screen share and then reshare. Maybe that can help.
Okay.
Like Vineet Jain has said, whoever has done annotation, they can use erase. Of course, nobody will know because if they have clicked it by mistake. Yes, yes, yes.
yeah, can you, Dr. Abhishek, can you stop your screen share and try and reshare?
Yeah, I'm just trying to do it.
Doctor, you need to close the PPT as well and reopen it.
Okay. But it will be sharing the screen, right?
Yeah, you can do.
What happens? Something is coming. I think the annotation is on or something. Can you take out the screen share and get back the screen share?
Fine now, it's fine. Thank
Now
you.
it's fine. No, it's not.
Yes, yes.
That annotations, whatever is there, you have to switch it.
It's gone, it's gone. I
Just
mean, at least. Thank you.
Thank you, doctor. We can resume.
Yeah, as I said, the diet, you have to consume more of vegetable-based, plant-based diet, and avoid or red meat, that is the pork, beef, and other poultry, and processed meats like sausages, hot dogs. These are the ones which are known to cause cancer, especially the colon cancer. Other thing which you can practice is regular physical activity. I think again some annotation is on. Hello.
So it's fine. Oops. Oh God. Yeah, something's
It
AI
can.
companion. Somebody has switched on AI companion by mistake. That's what I saw. Oh God. Okay. This AI companion star is all over yellow star. Yeah, yeah, yeah.
User 123 is doing that here.
One, two, three.
Yeah, it's user 123 doing that.
To stop it.
Do I need to stop sharing and again start?
It's okay, you can continue now.
Okay. Yeah, the physical activity, it has multifactorial way of benefiting in cancer prevention. It reduces the inflammation. The inflammation is known to help the cancer cells to grow at a faster rate because of certain factors which help in the growth of the cells. The physical activity is also known helps to reduce the weight. As you know, the obesity is one of the main factors which is also known to increase the risk for cancer. About 10 to 30% of the cancers are related to obesity, and about 13 different types of cancers are related to obesity, and obesity is a risk factor for 13 different types of cancer. I think it comes in the next slide. Okay. Physical activity also boosts the immune function. It also improves the hormone levels. Like again, it is related to the obesity, and reducing the fat mass helps to reduce the hormone levels. The adipose tissue, that is the fat cells, they are known to produce certain hormones like estrogens, which are one of the factors which leads to breast cancer. Also, the physical activity helps to improve the mental health. The stress also is known to release certain hormones in the body, which can increase the multiplication of the cells of the in the cancer. The aim of physical activity is to have at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise over a week. This is a WHO recommendation during a week. And for children, at least 1 hour of physical activity, outside physical activity, is recommended. And the screen time needs to be reduced. These are some of the modifications which can help you. Coming to importance in maintaining a healthy weight, excess body fat increases the risk of at least 13 different types of cancer, as we know it. And some of the cancers are the common cancers which have been associated with obesity are the breast, liver, stomach, prostate.
Start it again. Sorry, somebody is just playing with this. I don't know what's going on.
Please try and remove user 123 if possible.
Sure.
This could be some spam.
I'll proceed.
I think you'll have to reload your slide, Dr. Abhishek, because again we can't read anything.
Okay. Where is the screen share option? Not seen. Yeah.
Yeah, hi everyone. Good evening.
You're seeing now?
No, not
Hi,
yet. sir.
Dr. Supreet. Are you
Yes, I
on
am from
camera?
Aura Health.
Okay, awesome. Yeah, hi. So we were in the middle of the session hosted by Dr. Abhishek. There were some issues with the screen share. So yeah, please, Dr. Abhishek, did you figure out the screen share button? It's in green color. It's in the middle of your screen.
Yeah.
Yeah. Okay.
You can see now.
Yes.
Yes.
But yeah.
Oh, slideshow. Full
Yes.
slides.
I think I put the slide should be
Yeah.
seen.
We can see the
Yes,
slides.
yes.
Yeah, as I was saying, the increased body weight, that is obesity, has been associated with 13 different types of cancer. The obesity leads to cancer mainly because of 2-3 factors. That is, one is insulin resistance. Obesity is associated with insulin resistance, and the secretion of certain hormones, the secretion of estrogen, which is known to be a risk factor for breast cancer. And also in obese patients, in obese persons, there is more of inflammatory activity going on in the background as compared to normal weight persons. So this chronic inflammation helps in the growth of the cancer cells. So this is one of the factors which you can control. And rather than considering the BMI as a factor, you should consider the hip to height ratio as a more clear-cut indicator for maintaining the healthy weight. Anything less than 50% should be considered as a healthy to height ratio. That is a hip circumference versus height. The other most important thing is reducing alcohol consumption. Any amount of alcohol consumption is known to be a risk factor for cancer. You have to, if it's unavoidable or if you want to consume alcohol, you have to
Started
limit it
again.
to.
Started again. Sorry. Somebody is putting this. What's going on?
Yeah, if you continue to drink alcohol, you have to limit the consumption to at least 1 drink per day for women and 2 drinks per day for men. As far as possible, if you are able to control and then progress on to abstinence from alcohol, it helps in preventing cancer. The most important factor is smoking. It is known to, it is the cause in about 20% of all the cancers. The smoking is found to be the etiological factor. Smoking and also tobacco consumption in other forms, like tobacco chewing. This is almost 20% of the cancer-related deaths are also due to smoking. Most common cancer seen in smokers is lung cancer. So what you can do is you can try to start quitting, and if you're not able to quit, then you need to take help from medical professionals who can help you in quitting smoking. It can be in the form of some medications, or you can start with nicotine chewing gums, so that you don't get the urge to smoke. The smoking, 20 minutes after you stop smoking, the heart rate and blood pressures are seen to drop. Over 2 to 3 months, the circulation improves and lung function increases. In 1 to 9 months, the coughing and shortness of breath decreases. For a period of 1 year, the risk of coronary heart disease, that is IHD, is almost halved in smokers. And after 10 years, the lung cancer risk reduces by about 30 to 50% as compared to if you continue to smoke. So this is one of the major factors which can be controlled and which is in your hands. Managing stress and promoting mental well-being. The stress, for this you can take certain measures like meditation, help nurture social connections and relationships who can give you emotional support and helps in relief of stress. Develop certain hobbies and engage in activities which you enjoy, which promote relaxation and joy. And seek counseling if you are having any mental health issues or mental health problems, so that the stress is taken care of. Coming to regular cancer screenings, these were some of the tips which helps to control the risk factors for cancer and help in preventing development of cancer. There are certain regular cancer screenings and early detection measures which you can take. For that, initially, first you have to consult with your doctor and try to know your risk. That is, understanding the family risk and personal risk factors. The personal risk factors are the same. The lifestyle risk factors like smoking, alcohol, obesity, and physical activity. The family history is if there are multiple family members, like in our generations, who have developed the same kind of cancer or cancer which has been seen in the family at a younger age, then there is definitely some genetic reason for development of cancer. The genetic the cause of cancer can be genetic in only about 5% of the cases. The rest 95% of the cases are due to other most of those are due to modifiable risk factors. Then follow the guidelines, that is adhere to recommended screening schedules for your age and risk level. So what most of the recommendations which you see are for considering your age, but there once you have undergone a risk assessment with your family physician or a doctor, and if they feel that you are at an increased risk of cancer, they may advise you to undergo screening starting at a younger age. Be proactive, that is, report any unusual symptoms or changes to your healthcare provider immediately. Don't neglect any symptoms. I'll give you certain symptoms which may suggest cancer, okay, which needs to get evaluated immediately. Stay informed, keep up with the latest screening and technologies and recommendations. The warning signs of cancer, you can remember it as caution. That is, see change in bowel and bladder habits, a sore or a ulcer or a wound in them which does not heal for a long time, unusual bleeding or discharge, and a thickening or a lump in the breast, testicles or elsewhere, indigestion or any difficulty in swallowing. Then indigestion, that is which is persistent, which has been there for a long period of time. Then obvious change in size, color, shape, or thickness of a mole on the skin or a mouth sore. Nagging cough or hoarseness, which is not coming down with regular medicines. These are other symptoms which may indicate the presence of some form of cancer, that is like coughing of blood, persistent headaches, unexplained loss of weight or loss of appetite, that is reduced appetite, then chronic pain in the bones, persistent fatigue, nausea or vomiting, persistent low-grade fever, either constant or intermittent, repeated instances of infection. Cancer screening. What do you mean by screening? Screening is trying to detect cancer at a stage when it has not yet presented with symptoms. So you're detecting the cancer at a very early stage. Early detection of cancer greatly increases the chances of successful treatment, and you can receive curative treatment in very early stages. There are two major components of early detection of cancer, that is education to promote early diagnosis and screening. The screening recommendations, age 25 to 39, the screening recommendation is for cervical cancer screening starting at the age of 25 years. Okay, so starting from the age of 25 years, you need to have an annual pap test, 3-yearly pap test. And once you cross 29 years, you can go for co-testing, that is HPV DNA testing along with pap smear. At that time, you can go undergo screening every 5 years up to the age of 39 years. Then from 40 to 49 years, the screening recommendations of breast cancer, which is recommended beginning at the age of 45 years with an option to begin at the age of 40. That is, if you are feel you are at increased risk, obesity and other factors, then you can start your screening at 40 years. Cervical screening, as I already advised, starting at the age of 25 every 5 years. If any abnormal test result is there on screening, then they may recommend the next screening annually. Then colorectal cancer screening, it is recommended for everyone beginning at the age of 45 years. Usually advised screening method is stool for occult blood. That is the test which we get for colorectal cancer screening, and colonoscopy every 10 years. And if any changes are noted on these tests, then the screening can be recommended at the earlier time. Then the age of 50 plus years, the breast cancer screening will continue as recommended. That is annual mammograms. Then cervical cancer screening. Usually the cervical cancer screening can stop at the age of 65 to 69 years. That is considering the benefit of diagnosing a cancer at that age. Then the colorectal cancer screening will continue, and people who currently smoke or who have smoked before for more than 30 years, they should discuss with the doctor about lung cancer screening. the lung cancer screening is usually done with a low dose CT scan of the chest. And discussing again, the prostate cancer screening has to be discussed with the doctors, that is after the age of 50 years. There are different implications of screening for prostate, because most of us will develop prostate cancer during our lifetime, but it will be usually an incidental cancer. That is, it won't progress, it will be just there. But in some patients it can progress, so that is dependent on the certain risk factors, and that needs to be assessed by your doctor. And there should these prostate cancer screening, it may result in over treatment, because you will be trying to change the course of a disease which may actually not cause you problems even if it is left alone. So even prostate cancer, even if it is detected, the treatment is based on certain risk factors and certain the scan findings and the biopsy findings and the PSA levels. Okay, so based on that category, there is an option for surveillance also, even in patients who have developed prostate cancer. So all this needs to be discussed before you continue with your prostate cancer screening. Role of vaccines in cancer. Certain chronic infections are known to increase the risk of cancers. So hepatitis B is a viral infection. It is known to cause chronic inflammation in the liver. This chronic inflammation leads to development of liver cancers. That happens over a period of 20 years, 15 years of living with hepatitis B infection. There is a now very effective vaccine for hepatitis B, which can be taken and which helps in prevention of hepatitis cancer, liver cancer. Then HPV vaccine. It is advisable to be taken starting from the age of 11 to 26 years in both male and in female. It is known to prevent cancers, mainly the cervical cancer, and other than that, the anal cancer, vaginal cancer, penile cancers are also oral cancers. These are the cancers which can be prevented by HPV vaccine. They are more effective if it is taken in your early teenage years. Empowering patients through certain lifestyle changes, that is to help in the prevention of cancer. One is you have to have a knowledge, that is understanding the cancer risks and what are the prevention strategies to reduce that risk. Action, that is once you have understood the risks, you have to take certain actions. That is one is implementing the healthy lifestyle changes, which has to be followed daily. And consistency, that is same thing. Once you have developed healthy habits, you have to maintain those habits for a long period of time to see the lasting benefits. Empowerment, that is taking control of your health and reducing cancer risk. Thank you.
Thank you, doctor. We have a lot of questions on the chat button. Do you want me to read out these questions to you, or you want to read them out?
Yeah, you can read out to me.
Yeah.
I'll try to answer.
So question number 1, does multiple rounds of IVF was administered steroids, immune suppressant and other medicines for about 6 years. I had multiple miscarriages as well. Does it have an effect, and does it lead to a cause or risk for cancer?
The IVF treatment, yeah, it is known to cause increased risk of cancers, but you need to be under screening. The regular screening is only advised.
Okay. Meaning, so the question was, if I'm on multiple rounds of IVF or other medicines,
yeah, that depends on what medications exactly are used.
So medications related to IVF only, and it could have immune.
Yeah, in IVF also there are different kinds of medications. So depending on what medication is used, the risk will be there. So we need to go through on individual patient what medications they have received, and only depending on that we will be able to tell you. It cannot be a generalized opinion that IVF treatment will can increase the risk for cancer.
Okay. My
Certain
fa-
hormonal treatments or medications are known to increase the risk of breast cancer.
Oh, okay. Question number two is, my father had intestine cancer 15 years ago. What precautionary measures can I take and which detection test should I get? Because my father had cancer, intestine cancer.
Okay, intestinal cancer itself is a very broad term.
Hmm.
Okay, the intestinal cancer can be different types. Assuming if it's colon cancer, you need to undergo screening starting at the age of 45 years. That is every 10 years colonoscopy and blood stool for occult blood annually.
Okay, I
Okay.
hope.
There are other different kinds of cancer which don't have any screening or any modifications which you can make.
Hmm.
Okay, there are some intestinal cancers. It can be neuroendocrine tumors, can be certain gastrointestinal stromal tumors. These cannot be detected early by any screening methods as of now,
Okay.
and they are very rare. So the screening for them is not advisable.
Hmm. Sure. Third question. Hi, doctor. I did my scan 15 days back due to some health condition and got to know that both my ovaries are very bulky than the ideal size. PCOS or PCOD might be there, but what can be done to improve it? I do smoke, so just want to know if the condition is going to get worse.
Again, the PCOD itself, the treatment itself involves hormonal tablets.
Mhm.
So those hormonal tablets, what tablet, depending on what tablet you are using, there can be certain increased risk that you have to discuss with your gynecologist.
So I'll pitch in here, Dr. Abhishek. So
Yes.
this particular question about PCOD. So may I know the name of the lady who has asked that question, if that's okay?
It's Sakshi Rathi.
Okay, Sakshi, so PCOD, if we go drill down into it, it's basically a lifestyle disorder. So whatever you are eating, whatever you are consuming, your body is giving response to that, and it leads to PCOD. There are many factors playing part in it. It can be your sugar regulation, your obesity, and your fatty liver and all that. So the main part in it is to course correct for your lifestyle. If you are smoking, I'll urge you to give up smoking. I know it's not easy for somebody who is doing it, but you can seek help. So try to work on your lifestyle gradually with the help of your lifestyle modifications. Today, in today's time, we are able to reverse PCOD completely. So if you work on your lifestyle, eating habits, physical activity, you will be able to reverse it completely. But that needs a lot of willpower to change the lifestyle and physical activity. Yes, I hope that answers the question.
Yeah, again, PCOD is almost the same factors are responsible, like obesity and insulin
Definitely.
resistance, hormonal factors. So the same factors need to be taken care of.
Definitely.
Okay.
Sakshi, I hope we answered your question.
Yeah, I get it. Thank
Okay,
you.
okay, great. Yeah.
Okay, Dr. Supreet and Dr. Abhishek, do you think we can also focus on this question? What are the different types of cancer screenings which one can try?
Yeah,
Uh,
already as I have covered, there is cancer screening for cervix, breast, and colorectal cancers. And for prostate and lung, depending on the discussion with your doctor. These are the common screening for common cancers. Yeah, Dr. Suprita, you were trying to tell something.
no, I think you summed it up. That's okay. So
Okay.
I'll take in questions as and when, so that we both sort of
Supreet, do
pitch
you
in.
also want to just give a brief about how these screenings can also, some of these screenings can also be done at workplaces? And maybe if we can pick a few, which one are ideal for workplaces to do? Because there's a lot of taboo around it. We don't get a lot of time in our daily lives to actually go and get screened ourselves. So when our workplace takes these steps to do like a group screening, eventually to get yourself screened, because there is that convenience of your workplace doing these screenings. So out of the screenings that Dr. Abhishek mentioned, which of these could actually be done at the workplaces if possible?
Yeah. So, Dr. Abhishek, do you want me to take that question?
Sure, sure.
Okay.
I will chip in after
So,
you.
yeah, okay. So at workplace, we can do eye breast screenings for breast cancer detection. It can be done under 5 minutes. Can be done on site completely. Then we can do blood tumor marker tests. Those are sample based. So a phlebo can come at the client place and collect the sample of the people, and later on give them the reports when they are ready. So two things. One we can do is for breast screening, we can do eye breast examination, we can do pap smear also at the workplace, and we can do tumor marker test also. Those are blood based. So these can be done on site for the employees.
Thank you so much, Doctor.
Yeah.
Yeah, the tumor marker tests, they're not very specific. Okay. So usually it's not advisable as a screening method.
Yeah. So I like to differ here a bit, because I think prevention is better than cure, and there are tumor marker tests. So what happens in tumor marker tests, people? So please understand, there are certain substances or proteins that we identify in the blood. They are released when there is a cancer, by the cancer cells itself, or by the body in response to those cancer cells. So they very subtle, as Dr. Abhishek rightly said, but they give us a sort of warning, that something is wrong, and then you can go for the further investigation. So if I have to provide you an example or analogy, consider it like, the tumor marker tests to be like your smoke alarms, right? So smoke alarms go on when there is smoke in the house. Now smoke can be because of fire also, or because of a burnt toast also. So basically it tells you that there is something wrong, and then you can go for further screenings also. But they are important because they give you some information that something is going on in the body, and you need to take a proactive approach to sort of detect those things. Right, Dr. Abhishek?
Yeah, it's usually not used for the diagnosis. Usually we use the tumor markers once the patient is diagnosed with cancer. Mainly its usefulness is in monitoring the disease burden more so.
Okay.
Only one screening that is the marker which may be useful is the PSA. But again, as I said, the PSA itself has a lot of confusion or over treatment and other things. So it needs to be discussed before you are put on a PSA screening test. Other than that, the common marker which can be used is a CA125. Again, the elevation, there are many causes. It doesn't
To
directly
sum
show
it
that
up,
it's
yeah,
cancer.
to sum it up, basically, go for the screenings, but seek, advised or expert opinion also post your screenings.
Yeah, it is very important that you have a consultation post your screening so that they can assess the risk factors as well, and they can tailor the screening for you.
Yeah. Okay. Okay. Moving on. What do genetic causes mean? Does it follow that if my father and grandparents with the same bloodline had cancer, I can also have the possibility of it? If yes, what are the precautions? I am 32. Do you have any screening recommendation for me at this age?
Yeah, coming to genetic, there are two types of genetic causes. One is somatic, and other one is the germline. What is important for genetic ones, which is carried through generations, is the germline mutation. The somatic is it develops in each of the cancers. So when any person has a cancer and you test their uh, cancer tissue, you will find certain mutations. These are somatic mutations, and they are developed only in that person. These germline mutations, they are carried forward in the generations. So if you the again, depending on what is your family risk and what type of cancer each person had, they will require a complete family analysis. Okay, depending on that, there can be certain tests which can be advised. It will be genetic tests. They'll be first testing those which genes are positive, and if the tumor tissue is available from the index case, that is your father or grandfather, probably. that is available, then they can look for those genes and they can target and search if you have carried forward those genes. If you have carried forward those genes, then we can advise you for more intensive screening or sometimes some some certain medications are there. For breast cancer, there are hormonal treatments which can be advised to be taken for prevention
Okay.
to reduce the risk and to whatever so that cancer development can be postponed.
Sure. Dr. Supreet, you have something to add?
Sorry.
You wanted to add something here?
About, yes. So if I talk about when somebody says genetic, I'll sort of break down the things because people might not be able to understand the technical terms. So when somebody says heredity or genetic, what they usually mean is there is a mutation in their DNA, which is the building block. So, although certain cancers can be heredity or mutation based, like the breast cancer one, for them we have the specific test which we call as BRCA1, BRCA2. So, if somebody has a family history of breast cancer, then it's highly, I'll recommend that they should go for these mutation testings, which is called BRCA testings. Apart from that, it's not that simple that cancer can be transmitted, sort of inherited genetically, because there are other factors also playing a part. It is genetic mutation is there, but then there are other factors like your environment where you are living, your food habits, your lifestyle management, that also plays a part. But certain cancers, like I mentioned, specifically breast cancer or prostate cancer, they can be due to a genetic mutation in the DNA, and for them we have specific tests. And the second point was, somebody said that I'm 32 years old, right? What testing is recommended, right?
Yeah, I think the question was someone 32 years with father and
32.
grandfather having cancer, but not specifically mention what cancer.
What cancer? So like I mentioned, if they had colon cancer or any cancer, then people can go for colonoscopy time to time, or if somebody had breast cancer history, they can go for BRCA mutation identification also. And for cervical cancer, then the usual age starts for HP or what I can say pap smear is 21 years. But if somebody had a history of cervical cancer in their family, then they can start it around the same time if there is a history. So screening depends on, basically, if you had a family history, it starts early in that case.
Okay,
I hope I answered the question.
yes,
Yeah,
doctor.
the screening it is different for people who are at a higher risk.
Okay.
The recommendations are different for each individual, for each genetic marker which has been found.
Hmm. Okay. Uh, Shubha needs more information on liver cancer and its symptoms. Would you be able to brief briefly summarize on it? Liver cancer.
Liver cancer usually they present with very non-specific symptoms like abdominal pain or some abdominal discomfort, some dyspepsia, hiccups. They will be evaluated for some other abdominal symptoms, and usually they get picked up on the ultrasound or the imaging which is done. And there are certain markers. Once we suspect liver cancer, we can get the tumor markers done, which is AFP.
Okay.
So, hi, this is Akshay, Dr. Akshay, founder at Aura. I also like to add that we need to also figure in terms of the normal symptoms that come out of the cancer as well. So we have to be very sure, especially if it's a liver, that there will be pain, there might be a swelling. Sometimes yellowing of skin is also seen, nausea, vomiting, pale stools. That is something that can also come along with it. So I think that is also one thing that people have to realize when the liver cancer symptoms are associated. So that's what I would like to add on to that.
Yeah, some patients can have jaundice. They can present with jaundice.
I hope answers that question.
Stem cell therapy can cure or prevent cancer. That true?
Uh,
Which therapy? Can you repeat again?
Stem cell therapy. Stem cell.
Stem cells.
in terms of the I'll take the question if that's okay. In terms of stem cell, it's still a new innovation that has come through. Stem cell therapies are normally used in terms of the blood cancers and everything. So we wouldn't say right now that it will be the definite cure of cancer for every cancer that's there. Uh, Specific cancers are treated with stem cells. Of course, with the new innovations that are coming through, as we all know, the T cell therapy and all of that, we would expect the research to provide us a way more detailed input onto this, and we would be able to have much more clarity going forward with the stem cell therapy. But at the moment, if you say that it's going to cure it, then the answer is no. It can have a great effect on particular types of cancers.
It's still under research and innovation is going on in that field.
Okay. Okay. We have another question called, is the PSA test for prostate and should it be done if and someone is above 50? Should I get it done? PSA test for prostate.
It is recommended to be done after 50, but only after discussion with your doctor about the discussion with your doctor and the implications if a positive test is found. It should not be done like routine blood tests which you get done for medical examination or what do you call the health package. It should not be done like that. Ideally, it should be done after you have discussed with the doctor.
Okay. Anyone wants to add to this?
So I think what also we need to take on board, especially at the PSA, is it depends upon if you have some symptoms coming through, especially with the prostate cancer, difficulty anything else, then that has to be looked at. But as the doctor has already suggested that we need to go with the right prescription towards it, rather than just going directly through a package, is something that would be recommended. However, especially in the developed world, in the UK and the US, there's a particular way of looking at PSA. Normally, might do it at a year or 2 years or 5 years, depending upon risk factors associated with each individual. So that is how it's seen abroad as well. And there's a particular research segment that goes behind the PSA level as well. So, yeah, that's what I would like to add on.
Okay. Uh, Next question is, what if someone's family has back-to-back cases of cancer in the last 8 years? After getting the genetic testing done from the Tata Memorial Hospital, okay, the random case, what precautions we should take to avoid the risk of cancer? My father had gallbladder cancer, my mother had brain tumor, and my brother is diagnosed with glioblastoma 2.5 years back. Do you recommend any tests? I have back and neck pain for more than 12 years now, and after MRI and blood test, nothing has been diagnosed as of now.
So,
So, doctor, do you want to take that question? Or
I can take the question if you want. So in that sense, firstly, I think that is a great news that there is nothing that has come out. If I've rightly heard, is that right?
yeah.
Yeah. So I think that's the first step that we have to be grateful to everyone that if nothing has come out. Second step is when we say about the pain that is already existing, we need to figure out what is the cause of the pain. It could be a muscular, it could be anything else, it could be a joint pain, whatever that necessarily might be. Many times with the workload that we all have, especially on front of computers, many of the things are associated with the musculoskeletal issues. Just because you have a family history, only 10% of the cancers are familial in nature. Also, cancer is comparatively a rare phenomenon compared to the other chronic diseases. So chances of someone getting a cancer are comparatively low, whereas we are looking at a respiratory illness or a cardiac illness or whatever illness. So just because you have some particular symptoms or you have any familial history that goes into it doesn't mean that you'll necessarily get cancer at a young age. Huh? lot of people who have no familial history also end up with cancer. So it's a two-way street at the end of the day. But what we can suggest is if you have symptoms that are for longer time, it's better to consult your doctor and then take that forward. Doctors are there. Also limit yourself on terms of the Google, which provides lots of variations in terms of diagnosis without actually us understanding that that is the truth. So I think it's better to go through a medical professional, show it to them, and there are a lot of verticals, especially when you're looking at the pain. Do you need a physiotherapy? Do you need any other postural changes or occupational health changes? That is what you need to look at. But this is not necessarily that you have a pain for 10 days or longer is a cancer.
So he mentioned he has back and neck pain for 10 years, 12 years, but he didn't get diagnosed with, like, he did take MRI and blood tests, but nothing was diagnosed as cancer.
Right. So that's actually a good news. So 10 years, normally someone having a back pain and a neck pain generally indicates a chronic condition. It could be anything to do with arthritis. It could be do with the disc. It could be do with muscular issues. There are lots of things that come across. We can also needs to go through a health professional to actually go through a proper diagnosis. Someone who's having that kind of neck and pain as well needs to then either visit a physiotherapist or either needs to look at an orthopedic, or you can also go to any other consultant that they know from a general practice as well. I hope that answers your question.
Dr. Abhishek or Dr. Supreet, you guys want to add more to this?
Yeah,
Yeah,
just that. Yeah, go ahead, doctor. Yeah.
the neck pain or the back pain itself is you cannot attribute it to cancer. So, but any pain you need to consult a doctor and not take only over the counter medications. The cause for the pain needs to be assessed, and any factors which may uh, direct towards treatment to be taken care of. And coming to the family history, the proper way is to get a genetic counseling done and see if already two members in the family have three members in the family, as you said, right? If they have cancer, then it's better to go with genetic counseling and try to assess the risk of developing cancer in you. It needs a lot of information, more information to arrive what tests you will require specifically. Yeah, Dr. Suprit.
Yeah, just summing it up what you already said. Uh, first of all, I will urge you not to panic because I understand the situation in your house. Everybody, sort of has cancer. So I understand the panic associated with it. But what I will urge you is go for regular screenings from time to time, consult a doctor, and don't go overboard with it. So, have a healthy lifestyle, eat healthy food, eat what we call as rainbow diet, and have your physical activity in place, and don't panic. Just the regular screening from time to time should be good enough for you.
Yeah. Okay.
All right.
Uh, next, Shwarya Patil has a question. What are the causes of leukemia?
Dr. Abhishek, you're taking that?
Leukemia, actually, surgical oncologist, we don't deal much with leukemias.
Generally, when we say as a issue with the lymphatic system, so a lot of things can come into play, especially when the leukemia is comes across. Mainly it looks towards the genetic mutations. Sometimes the blood cells can cause uncontrollable growth. There are also we can also look at the radiation exposures as well. People who, when you look at say Japan, when there was a nuclear bomb over there, a lot of people ended up with leukemia because of the nuclear medicine. What happened over there. So that is another radiation exposure that comes across. There's also a thing with chemical exposure that comes into place as well. Sometimes people who are working in industrial emissions, and sometimes they are linked with the particular chemicals like benzene or anything like that, that can also affect people's reaction towards getting leukemia as well. Also, there's a risk towards the genetic side as well. So that needs to, someone has a close relative with leukemia, that also slightly increases the risk, not necessarily a direct risk. In terms of the immune disorders as well, especially someone who has HIV or AIDS or any person who has gone through a organ transplant and has a immunosuppressants given to them, also it could be a possibility of having a leukemia. Also, we need to know that there's a very virus called the EBV, basically the Epstein-Barr virus, which is linked to leukemia as well. So I think someone who's exposed that to particular kind of a virus is also can lead to that as well. Also, in top of that, we should also understand that the health and lifestyle is an extremely important role. People who are on a higher intensity of smoking also can be at a risk of acute leukemia. So that is something also one should be careful about. So I think that should encompass the most of the causes that affect the leukemia. Yeah, which causes. Hope I answered your question.
Okay, next question is, can somebody with no symptoms and red flags, go for a PET scan? Just to be fully sure, are there any side effects of doing PET scan once every 2 years? Will a hospital or a doctor give you a PET scan without any symptoms if you want to do it voluntarily?
Can you come again?
Sorry, we lost you there.
Your
Yeah,
voice is
it was
not clear.
breaking the
Yeah,
voice.
Okay, am I audible now?
Yeah.
better.
Okay. Can someone who has been showing no symptoms or red flags go for a PET scan? I just want to know, will a hospital or a doctor give you a PET scan without any symptoms if you want to do it voluntarily? Are there any side effects of doing a PET scan once every 2 years?
So, frankly speaking, one should not be going for a PET scan without any symptom. The reason being, a PET scan is normally used for the diagnosis of cancer. So someone who having a symptom with a very specific need, then only they are asked to do a PET scan. It has a high exposure to radiation as well, and then they have to inject a dye as well in them, which can also have allergic reactions as well. So I think I would not highly recommend anyone to do a 2 yearly PET scan. It's called PET scan actually. So it's not something that is advisable. Hopefully that answers the question.
Yeah, that summarizes it. The PET scan is definitely not a screening test. It's mainly once you have symptoms and when we are suspecting a cancer, then only we advise for a PET scan. It's usually used for staging and for assessment of the treatment. Okay, have you responded to the treatment for the assessment? These are the two main indications for a PET scan. Definitely not a screening test and definitely not once in 2 years. The risk of radiation itself for a PET scan is high. So that itself can be a risk for cancer. So unnecessary PET scan is not advisable.
Because please understand, at the end of the day, these are radiations only. So why would you put it without any reason, any valid reason?
Got it. Okay. Okay. I am suffering from autoimmune hepatitis from the last 4 years, and I am on steroids as well as immunosuppressants from the last 4 years. Does this develop a high risk of liver cancer or cirrhosis, and can it be prevented by any precautions?
So
Yeah.
whether doctor you want to take it or should I?
Yeah, you can take the question, Dr. Akshay.
I think the key thing with people who are having the hepatitis is we need to make sure that you're regularly monitored, your medication adherence is there, and you maintain a healthy lifestyle. Not necessarily you will end up developing a liver cancer or cirrhosis. I think highly recommended to go through a screening routine with the doctor that has recommended as well. So that would suffice is something that
Okay.
Yeah, autoimmune hepatitis itself is a chronic inflammatory state. So there is inflammation in the liver. So there is a slightly increased risk for cancer. So you need to be undergo regular screening. That is, you can get a ultrasound scan and a AFP yearly. Probably it's already advised for you.
All right. Question. Cancer like a blood cancer, do we have any vaccine for this? Also, my sister is going through the same and it's a relapse case. What she should avoid in food habits so the treatment is smoother?
And
So
Dr. Abhishek, you want to take that? Please go ahead. You want to take that?
blood cancer, yeah, definitely. I didn't get the question properly.
Okay, the question was that uh, is there any vaccine for blood cancer?
No, there is no vaccine for blood cancer.
Okay. My sister is going through blood cancer right now and it's a relapse case. What she should matlab, what food habits she should go for so that her treatment is smoother?
So treatment, food wise, it's all this, same
Same.
for everybody. It has to be simple, nutritious food, no fast food, no junk food that has lot of additives in it. Lot of processed food. It's basic thing that you have to have simple home cooked simple meal with rainbow diet, and more colorful food you have, more antioxidants you have. So it's the same thing. There is nothing special or extra that one can have to avoid cancer. Just follow the protocol of your doctors and try to minimize the processed or outside food. That will be it.
Also, to add on to that, what I would highly suggest is to go to a dietitian. I think they should be able to recommend you a proper diet, or a nutritionist can give you an add-on. The reason why I'm saying is many of the individuals who are going through cancer do suffer from anorexia, that is a amount of appetite and not eating enough. So I think I would highly suggest to have food that is nutritious, but also have some fun days as well along with it. Because eating the same thing every day, which is healthy, is also not, you'll always find it hard. So there should be some 1 or 2 days where you also should eat what you enjoy as well. That is also would be recommended. But I would highly suggest to take a dietitian overview on this to take your nutritional need looked after. I hope it answers the question.
We'll take one last question before we end today's webinar. Is there any permanent treatment for multiple myeloma? Please brief me about bone marrow transplant and the risks involved. What are any alternative treatments available as of now? What are the causes of this reoccurring after chemotherapy with Borvis? It's a slightly technical question. Maybe I'm not pronouncing these right. What are the causes of multiple myeloma? Patient is 52 years male, no alcohol and smoking habits, no past cancer cases in the family.
I think what we need to go back in terms of the causes would be very we need to figure out what has happened in
Dr.
terms of.
Akshay, can you be slightly louder, please?
You want me to be louder? Can you hear
Yeah.
me now?
Yes, I can. Yeah.
So I think let me go back to the bone alternative treatments for bone marrow transplant. I think the first thing we need to understand with uh, bone marrow transplant, this is a risky procedure at the end of the day. There's new therapies that are coming in terms of how cancer can be treated. Some things like targeted therapy that come in. There is something called immunotherapy that is coming in. One of the latest research is the CAR cell therapy as well. CAR T cell. So there are lots of things that are coming up in terms of the immunotherapy. Of course, the standard treatments are always available, like the chemotherapies as well. But I think as we move ahead, there will be lots of new therapies that will keep coming on. In terms of the multiple myeloma and what also causes it is, in terms of, as I said before, for the leukemia as well. Genetic mutations cause one of the main things. More the older we become, the chances of getting the cancer becomes higher. family history again doubles the risk. Pre-existing conditions are there, like autoimmune diseases also puts us a little bit more on a higher risk. And in terms of the same, which I explained from the leukemia side as well, whether it's chemical exposure, radiation exposure, petroleum products, and everything is similar kind of risk factors that increases our low exercise, high obesity is another thing that we need to take care of. Any chronic and viral infections, as I said before as well, Epstein-Barr virus, or it could be HIV, we need to take care of as well. So that answers the questions. But there is no guaranteed way to prevent a multiple myeloma. You can always reduce the risk through maintaining a good lifestyle.
It's only the general measures, what preventive measures you can take. There are nothing specific measures which you can take to prevent multiple myeloma.
Okay. I think we have a few more questions, but we are already 10 minutes ahead of the time. So, can the team Aura Health and Dr. Abhishek, can you put in your contact details on the chat so that people can reach out to you directly?
Yeah, sure. I'll leave my email ID.
Yes, please. Thank you.
Yeah, I see a question. I like to take it
Sure.
just at the bottom. Have been hearing eating in right order, veggies first, protein, fat second, starches last, helps in reducing the cancer inflammation and also in long run for recovery from cancer. So what you have suggested, it works for your metabolic disorders. If we talk about diabetes specifically, so this order works there. You have your veggies first. So idea is when you eat veggies, it creates a jelly like coating inside, and when you pair it up with fat, and when you are eating anything that's rich in carb, it sort of slows down the digestion. So there is no spike when you are eating a carb. So this works for metabolic disorders, specifically for diabetes, but it doesn't have to do anything directly with cancer. It is the way if somebody is a pre-diabetic or a diabetic, they can follow this pattern of eating in the right order. It's not directly linked to cancer in any way. There are no studies substantiating this order for cancer. So I'll suggest you, so not go by these half-baked studies that come out or what influencers are telling you. Always go by what your doctor is telling you, or if you are tech savvy, you read about it on the internet. Go with the relevant studies that have proven effects, that have proven research behind them, not just anybody telling you what to eat in what order and it will cure cancer. It doesn't work like that. Mahesh, I hope I answered the question.
Yeah.
Thank
Thank you. Thank you so much, everyone.
Bye
thank you.
everyone, have a
Bye.
great evening ahead. Take care. Bye.
Thank
Yeah,
you.
thank you,
Bye.
everyone. Bye.